Welcome, beautiful people, to the start of the Sowing Seeds Neurology webinar. My name is Aldwin Samari. I'm a fourth year at PCOM, Georgia. Today I'll be moderating, and I am the National Osteopathic Committee co-chair. The Sowing Seeds series is part of our Sowing Seeds program created by our national president, Asase Obo, in collaboration with the Alumni and Multicultural Affairs National Committee. Throughout this year's long program, we will provide resources on how to succeed as a pre-med and medical student, and we'll touch on everything from financial literacy to preparing for board exams and more. So make sure you are a national member by visiting the snma.org and signing up to stay in the know. So before we go on, we're going to do a brief introduction to each and every one of the panelists. Our first panelist is Dr. Charles Flippin, who is the Richard and Ruth Walter Professor Vice Chair for Education Residency Program Director, Department of Neurology, David Geffen School of Medicine at UCLA.
Thank you, Aldwin.
No problem. Our next panelist is Dr. Maima Akinsanya, who is a Neuroimmunology Fellow at the National Institute of Health.
Thank you.
Next up is Dr. Dorothy P. Dada, who is a headache and facial pain traumatic brain injury physician, and she's also at St. John's Physicians Partners in Providence Medical Center.
Hi, Aldwin. Thank you.
Next up is Dr. Isaiah J. Rowe, who is a DO and PhD, double doctor, and he's a resident at Emory in Atlanta, a neurology resident at Emory, Atlanta, third year. And last but not least, Dr. Shawn Moore, who's a PGY2 at Baylor in Houston, Texas. So I welcome all the panelists. Thank you for taking the time out to enlighten, inspire, and educate our students about the wonderful field of neurology. So before we get into the audience's questions, I would like for each and every one of you to do a brief bio about your journey, where you went to medical school, where you went to residency, why did you choose neurology, and then last, what was the most challenging thing you faced going into neurology? So we'll start with Dr. Charles Flippin, and then we'll go in the same order that I had introduced you. Thank you.
Thank you, Aldwin. So I'm originally from Flint, Michigan. I think pretty much everyone knows where Flint is now after our unfortunate public health crisis. And attended Northwestern University undergrad and the University of Michigan for medical school. When I was there, we made up, Black students made up about 10% of the class. And from there, I went to University of Maryland for my neurology residency, and then did a headache medicine fellowship at Henry Ford Hospital in Detroit, Michigan. I spent my first 2 years out of training on faculty at Indiana University, and then followed my wife, who's a native Los Angelian, out to UCLA, and I've been here for over 20 years. And I chose neurology in part because I like puzzles. I like figuring out puzzles, and along with that, neurology seemed to be the thing that was closest to my concept of being a doctor. 80% of what we do is talking to patients and listening to their stories. And then we use our physical examination to actually confirm what we already think is going on once we've acquired that history. So it was the talking to patients, hearing those stories and laying hands that really drew me to neurology. I was helped along the way by mentors. After my first year of medical school, I did research in pain, something that had also been an interest of mine, which is why I'm a headache medicine subspecialist. And the neurologist that I followed around in my research project also took me on inpatient consultation rounds. And I don't know if he was trying to recruit me, but it stuck. The things that they did and how they could examine a patient and be able to predict what they were going to find on the imaging, that was really, to me, that was like magic. And so I have had a fun-filled 20 plus year career doing something that every day is different, every day is interesting, and I can't think of any other branch of medicine that I think I would have found as satisfying as neurology.
Thank you, Dr. Flippin, for a wonderful introduction. Next up, we have Dr. Maima Akinsanya. But before we get to her, please, audience, please ask questions. These neurologists are here for you, to support you, and they have wonderful and terrific stories that they can share and impart upon you. So please, please, please ask the questions. Now, without further ado, Dr. Akinsanya.
Hey everyone, again, I'm Maima. I am originally from Nigeria and came here when I was really young. I was only one and grew up in Jersey. I went to Montclair State, which is one of the state schools in Jersey, and studied molecular biology there. And that is where my kind of desire to go to medical school was cultivated. I ended up learning about DO schools during my undergrad and was really intrigued. So I ended up going to Toro College of Osteopathic Medicine. And that is where I learned about multiple sclerosis. So I was intrigued by neurology, but, wanted to keep an open mind and see what other specialties kind of caught my attention. But when I did my other rotations, I realized I really loved neurology the best. So I ended up going to Emory for my neurology residency, which I just graduated 2 months ago now, back in June. And I absolutely loved it. And while I was at Emory, my love for neuroimmunology was really solidified. And I realized that, the multiple sclerosis rotation I did back in med school was not just kind of a fleeting interest. It's definitely where I wanted to focus and dedicate my neuroscience career to. So I'm currently a neuroimmunology fellow at the NIH. So I'm in DC right now and just started, but loving it so far. In terms of why neurology, again, I had kind of an interest in it, honestly, back to undergrad or actually high school. I remember I did an AP psychology class where we had to learn about the different lobes of the brain and, neuroanatomy, very basic stuff, but I was really interested in it. But initially I thought maybe I would do psychiatry because I really loved human behavior. But when I did my psychiatry rotation, I realized it wasn't exactly what I thought it would be. And I did my neuro rotation afterwards, and I just fell in love. I loved the pathology. I loved, the thinking skills, putting on my detective hat. Really, I just love to sit and think in general. Like, I'm an over analyzer, so it just is very much so up my alley to really take my time to think about something and try and figure something out. And I just loved it. I loved to go home and read about the cases. I loved the patients. And I found it really, really intellectually stimulating. And some really good advice that a mentor had given me is, go with whatever you find yourself intellectually stimulated by, whatever you find yourself curious by, because every specialty, every program is going to have its, pros and cons. But you want something that at the end of the day you find intriguing. And, that's one of the main reasons why a lot of us are even in medicine, because we like it, we enjoy it, and, we find it interesting. So you want that to be continued throughout your career, despite, the red tape and things like that you have to go through. So I'm really happy that I ended up choosing neurology.
Thank you, Dr. Akinsanya. Dr. Dorothy Dada, you're up next.
Hi, I'm Dr. Dorothy Dada. I am a general neurologist and a headache and facial pain specialist. I also specialize in traumatic brain injury and concussion. I'm from California. I grew up in Riverside, California. And I went to an HBCU for undergrad. I went to University of Maryland Eastern Shore. And I was a pre-med bio major. And I got interested in neurology probably I would say my second year of undergrad, I was taking a course. It was like a biopsych course, and they started teaching us about the nervous system. And they were teaching at that time that the brain and the spinal cord didn't have the capacity to regenerate. And I thought that was so fascinating and so troubling to me. I wanted to actually do something about it. And it actually is what changed my mind about going into medicine. I actually decided that I wasn't going to become a physician, that I was going to become a scientist, and I was going to help figure out how to improve the function of patients who have these sort of injuries. And so I decided to forego medical school, and I went straight to a PhD program in neuroscience after graduating from UMES. And I did my PhD program at UCLA, and I studied the molecular mechanisms involved in brain repair after a brain injury. And after that, I did a postdoc in health services research, understanding how our health systems are structured and how to restructure our health systems in order to improve the care that we deliver to our patients. And, you know, I was able to blend kind of my love for patient care with that fascination for understanding how we do what we do, why we do what we do, and helping patients understand kind of the pathology a little bit more. And I actually went to medical school after finishing a PhD and a postdoc, and went to medical school at Loma Linda University, and then returned to UCLA for my residency in neurology. And actually, Dr. Flippin was my program director while I was there. I've been in practice in Los Angeles. I have offices in Santa Monica, Los Angeles, as well as Playa Vista. And I see adult and adolescent patients with headache and facial pain and concussion, as well as general neurology. I think the reason why I chose those specialties, those subspecialties of neurology, is that you know, neurology is a unique field in that there are a lot of conditions that you can't cure. And patients have to figure out, and you have to help them figure out how to live their lives without removing that issue, that challenge, finding a way through as opposed to finding a way around. And that really spoke to me. It's something that I value highly in what we do as neurologists, and especially in headache and facial pain, as well as patients with concussion. The reason why we're boarded in neurology and psychiatry is because there's a lot of mix, a lot of mesh between the brain and the mind, and really helping people understand what's happening with them as they're going through these situations, and finding a way through for them is really just so valuable and so important. Patients are so grateful to understand their condition and what to expect next. I think that's it.
Thank you, Dr. Dada. Dr.
Yeah.
Rowe?
Yeah, everyone, I'm Isaiah Roll. I'm so excited to be here. Many people who might know me know I love SMA, I love mentorship and sharing, pretty dear to my heart, so I'm glad to be here. I am a PGY3, a third-year neurology resident at Emory University. Some of my background, born and raised in Harlem, New York City. I left there for college. I went to an HBCU, Oakwood University in Huntsville, Alabama, which was a culture shock coming from New York City and going straight down there. Similarly to Dr. Dada, after undergrad, where I majored in biology, I had an interest in the brain from a kid. I think I had been kind of biased almost all my life. I had just fallen in love with the idea of the brain. I used to tell my mom I thought the brain was cool. I understood from maybe 8 or 9 years old that the brain controlled, just about everything in the body, and that was by itself fascinating enough to me, as well as the fact that I also understood somehow as a kid that we didn't know enough about the brain. I always told people that the heart was figured out. We knew the chambers, we knew where the blood pumps, but who can figure out the brain? And I think that opportunity for challenge, kind of intrigued me in doing something that I felt was greater. I've had that just since I was young. And so I've always kind of thought the brain was cool, been sort of into the brain and kind of neurosciences. So in undergrad, I studied biology. But while I was there, I did research in my summers on a number of topics, neuroscience, cancer, in different varieties. But I ended up pursuing a PhD in neuroscience. I thought in the same way that, I wanted to kind of figure things out, and figure out how they worked and try to actually go for cures, as opposed to just trying to treat or manage. My idea at the time in undergrad of neurology was, even though I love brain, I thought my idea or my impression was that it was kind of grim. It was sort of, a lot of conditions that were chronic and couldn't be treated. And so I thought, let me put my passion into research. So I did a PhD in neuroscience. I went to the University of Cincinnati and I studied epilepsy, basic science research, mouse models, trying to figure out exactly what cells can cause epilepsy. If I can identify what those are, can we recreate it? And can I try to stop seizures, prevent seizures, reverse seizures, in these mouse models? But while I was there, and I love my research, and I love my lab, and I was kind of nearing the end of it, I still had this itch to see people, see patients, to connect with people. We'd have some people call the lab. I worked in a children's hospital, and patients would mistakenly call our lab thinking that it was a physician asking questions about their child's treatment, or if we could kind of answer questions. And I was like, oh, yeah, this is the wrong person, wrong number. I felt very uncomfortable. I knew I didn't have that knowledge, but I felt insecure that I was studying a topic, but I couldn't apply it to a patient right in front of me. And I always thought if someone had a seizure right in front of me, I could probably postulate what was happening in their brain and think about like, oh yeah, probably his neurons are firing, but I couldn't help them in that moment. And that didn't really sit well with me. And so I then went into medical school after finishing my PhD, had a postdoc lined up, but I kind of, forewent that for medical school. I went to a DO program, Ohio University, just fell in love with the idea of the approach of medicine and kind of using your hands in treatment. And so I went to OU, and following that, began residency. Excuse my, if you hear my children in the background. I'm also a father of 2 little girls, 7 and 4. So they're running around the house acting a mess right now. I'm in residency at Emory University right now, as a 3rd year resident, loving every moment of it, just the opportunity to learn. And right now, I think that what I love about neurology, at least from my perspective as a resident, is one, being able to educate patients about their brain, just kind of having them have that aha moment, as well as actually educating a lot of other physicians about the brain. You get consults from other doctors who will call you about things, and you get to have this dialogue as a specialist to kind of say, hey, what are you thinking is going on? And then kind of let me help you figure out what's happening with your patient. And so really kind of considering helping someone out in their patient in a hospital setting is really kind of appealing to me. I can have a lot of great conversations with other radiologists and other medicine physicians and try to figure out the problem kind of together, but use my expertise and use what they think they already know so far to kind of get to the problem. So I kind of love that aspect of it. I would say also briefly, my journey of medicine is one that has not been without struggle or stress or strain. It's not like, walking on roses the entire path, just from undergrad to doing graduate school and then flipping that and to get into medical school and trying to get into medical school from that standpoint was a challenge. Failed exams, MCATs, and, you name it. I've been there. I've applied to multiple things multiple times over. And so, I'm always willing to share on a different time or more of that part of the journey, but just, I always advise never to give up. I don't chase titles or don't chase names, but, finding a program or finding people that will really support you, get to know you really well is kind of always my advice. And I didn't have any mentorship in medicine until, halfway through medical school. And I was actually paired with a Black male neurologist who I had never seen before up until that time. And that, had been a major change in my trajectory of my career after having a mentor. It's one thing to kind of go through life, but another thing to step into medicine, but I think it's a whole nother life. And so you need people to just almost tell you like what to do sometimes. Like I just get to a point where I'm like, I literally have no idea what to do next. And so to be able to have someone as a sounding board who's been there, experienced in it, who actually knows you, knows your values to kind of give you mentorship, in return, really kind of, change where I am today. And so definitely I like to be mentors to those who I can be. And I advise everyone to just try to find it as much as they possibly can. So happy to be here, and I welcome to answer questions at the end. Thanks.
Thank you, Dr. Rowe. Dr. Moore?
Hello, everybody. I'm Dr. Shawn Moore, currently second year neurology resident at Baylor College of Medicine in Houston. So I'm originally from St. Louis, Missouri, born and raised. Did all of my undergrad education as well as graduate school and medical school in the state of Missouri. For undergrad, I went to University of Missouri at Columbia, where I majored in biology, where I got my bachelor's degree. I didn't come onto the realization that I wanted to be a physician until late in my undergrad career, around my end of my junior year, beginning of senior year, where I finally decided that I wanted to at least give medical school a shot. But since it was a little late as far as taking MCAT, getting application out, I decided to do a graduate program while I work on applying, and also really decide whether or not medicine was truly for me. I then went to St. Louis University, where I pursued a Master's of Science in Anatomy. And at that time, that's where I really discovered my love for neurosciences. During my second semester, my first year, we had a anatomy and a neurobiology course. And during my neurobiology course, that's when I discovered my love for neuroscience by learning how the nervous system controls everything from your motor system to movements, sensation, your heartbeat, your respirations, and just learning about the different pathologies involved that can affect the nervous system and how it affects everyday life was very interesting to me. I also had interest in learning about neuroanatomy and doing gross dissection. So I initially thought that my future was in neurosurgery. Went to medical school all for neurosurgery from years 1 to the beginning of my 4th year, when I really got exposure to neurosurgery and started to have a change of heart. But initially thought that I wanted to do general surgery, because I thought when it came to neurosurgery, what interested me most was doing procedures and being able to work with my hands and being able to affect individuals' lives through different surgical procedures. And I actually did a year of general surgery before doing neurology. So even though it's my second year in neurology, it's actually my 3rd year as a resident. So I kind of went a roundabout route. But during my surgery year, within a first month, I started realizing that the part of neurosurgery that I was more interested in was the neuroscience aspect more than the surgery aspect. And also with having exposure previously to interventional neurology, I knew I could also do procedures within neurology. So I came to the conclusion that I wanted to pursue a career in stroke and interventional neurology, and reapplied during my first year of surgery residency and matched at Baylor for neurology. I'll say probably one of my biggest obstacles when applying for neurology for me personally was my background. I having the prior interest in neurosurgery and doing a year of general surgery didn't always sit well with a lot of programs, because there was some question in my dedication to the field of neurology, whether or not I would be truly interested in a more medical specialty than a procedural specialty. But I can honestly say, since I've started neurology residency, and especially now that I'm a second year and fully ingrained in the field of neurology, that I know that I've made the best choice. Just getting to see so many different pathologies within neurology, different things such as multiple sclerosis patients, ALS patients, acute stroke patients that come in with significant deficits that receive the proper treatment if they're within those windows for treatment, and having a complete 180 turnaround, and some even get to go home and go back to their normal lives. And just, even though there are a lot of conditions and there are a lot of unknowns within neurology, there have been such tremendous strides and improvement in the field. And even things, conditions that are still very debilitating, but such as strokes, now have come to the point where we do have different treatment strategies and mechanisms that we can completely turn people's lives around.
Thank you, Dr. Moore. And as always, please, audience, I encourage you to ask questions. We have some wonderful guests here and panelists that are willing to answer your questions. So with that being said, our first question comes from student Dr. Stephanie Reyes. With interviews going virtual this year, how can applicants best determine fit in regards to culture, program support for residents, compatibility with current residents, faculty, before, during, and after interviews with residency programs? I'll direct this question first to Dr. Flippin, and anyone else can answer afterward.
Thank you. This is going to be an interesting experience on both sides of the interview table. So it's going to be a challenge because as Dr. Dada and I were talking before the session began, people usually do an audition clerkship in order to be able to try on a place that they think they really are interested in. They get to go and feel it. You're not going to have that experience this year. So I know that my colleagues in medical education, in graduate medical education, and other program directors, we're working very hard to give you as much of an organic feel of our various programs through our digital presence. And so you're going to see enhanced digital presence from all the programs around the country. One thing that I think most programs will do is give access to the current trainees in their programs. We're looking at having regular sessions where people can go online and ask questions of current residents about their experience, about living in a given city, in our case in Los Angeles, and how is that? And I think in particular, we will make certain that our residents of color are available to answer questions. And I think it's important that you as applicants make certain that you look at all of those access points that programs are providing to you, the website, any special programs that they're putting on for applicants in particular. During the interview season, once interviews start, they're all going to be virtual, but most people will have some sort of social interaction attached to the formal interview process. We're thinking about normally we would have a dinner the night before our interview day where residents and applicants can mix without faculty around, and you can ask all the questions that you want that you may not think, oh, I don't think a faculty member wants me to ask that question. We're going to do something similar this year so that we don't lose that opportunity for applicants and the current residents to have authentic conversation. And then it's after interviews and during the period of time between the end of interviews for a given program and the deadline for rank list submission, I think that everyone will be open to having more conversation after that interview day. In the past, there's been this sort of discouragement of people reaching out to programs afterwards, but I think that will probably be tamped down this year, just because we realize that there's a lot of uncertainty and we want to be able to communicate with applicants and let them know how much we're interested in you all, and you can let us know how much you're interested in us, and that will help the process along. I hope that was helpful.
Certainly was. Dr. Akinsanya, you have some remarks as well, so you may answer.
Yeah, Stephanie, I really feel for you all because kind of figuring out the program's vibe was very important for me because I'm an extrovert, I'm social, so I knew I couldn't be at a program where I didn't see myself, getting along with people, seeing myself in the culture, and not just a resident and not just someone, going through the motions as a means to an end. So that was such an integral part of me choosing Emory. And so I can imagine if I was choosing now how, it's definitely a different challenge. But, something you all should know is that programs are very aware of this and they definitely want to still, advertise themselves to you because you guys are the buyers, program, you guys are great students and programs want you to be part of their community. So they want to convince you to come even though you're not able to interact the traditional way. So like Dr. Flippin was saying, programs are definitely going to be doing a lot of virtual events and, social things to try and substitute what the normal interview dinners and interactions you would have normally had with residents. And just don't be afraid to ask questions and don't be afraid to say, if you have to send 1,000 emails, send 1,000 emails. Don't be afraid to ask for emails of chief residents or whatever residents are willing to speak. I'm sure most programs probably will set up some type of committee for things like that. And even if they don't have something formal set up, I'm sure be more than willing to, give information so that you can get whatever information you need. And, in the circumstances, just try and still gauge how, if there's some type of virtual interview dinner, still try and see how the residents interact with each other, still try and see how how receptive the program director seems to be, still ask the residents, how supportive do you think your program director is? How well do you get along with your co-residents? Do you feel like, you guys are a family? What do you guys do outside of work? And definitely if there are minority residents, I would, specifically ask that too. If you could speak with them and make sure that they feel supported at their program and that it would be a welcoming and good environment for, all those, especially listening, who are minority students. I would definitely prioritize that as well and make sure that you get the questions answered that you need and the priorities you have. I wouldn't say that just because things are going to be virtual means that you kind of have to go with a bunch of question marks. This is still a huge decision for you all, and you guys should still be able to make an informed decision that you're confident in. So ask as many questions as you need, and don't be afraid to reach out and say, hey, I still need a little bit more information.
Thank you, Dr. Akinsanya. Any more questions? Oh, okay. All right. Sorry if I don't say your name appropriately, but student Dr. Ubadiah Abdul says, neurology is a hard field to get into residency. How do I make myself competitive? So I'm going to go back to Dr. Flippin.
So I wouldn't look at it as being as it being difficult to get a position. I think that it's do you get the position that fits you best, and I think that's the most important thing. Once you decided that you want to be a neurologist, you will get a position. How do you make yourself an attractive applicant? I think it's being authentic. Don't try and make yourself into what you think a given program wants. So if you're not interested in research, then going to a program that has all MD PhDs, and nothing against the MD PhDs on the panel, but if you have if you have a program that has all MD PhDs and everybody goes into the lab, then maybe that's not the culture that you are going to fit into. if you have an idea of what kind of career you want to have, if you want to go into practice, then you know that you want to have a lot of experience taking care of patients. And so you want to go to a place where you will get that experience. I think billing yourself as authentic as you can, what it is that you want. It is a buyer's market and you're buying. So you put yourself out there, expressing what it is that you want out of a career. I think anytime that you display leadership skills and have had opportunities to lead, because you will be a leader, you will lead a healthcare team when you finish residency, or you will lead a practice. And so people who are leaders, they tend to show well during this process. Obviously the scores and things like that, it depends on the program. We don't have cutoffs for step scores. In our program, we look at people in a very holistic fashion, which I think gives us a great mix of residents. They're not all the same, but they all fit together. So I think being authentic is the important thing. And then if there's a place that you know that you really want to train, then you're going to make the extra effort of reaching out and demonstrating that's the place that you want to be.
Thank you, Dr. Flippin. So student Dr. Obianju Anaju Nwama, who she actually goes to my school, so shout out to Obi. Love you, Obi. How does neurology as a specialty differ from physical medicine and rehabilitation? I'll direct this question to Dr. Shawn Moore.
Thanks again. So I'll say one of the main differences between neurology and physical rehabilitation as a specialty is that neurology as itself is more so focused on diagnosing and treating diseases. And PM&R does kind of help as a complement because there are a lot of conditions that have permanent deficits, such as one of the major ones are, stroke patients who have major deficits, such as they can't use one side of their body, or they have difficulty with speech. And, the process to healing and recovery will require a lot of physical therapy, a lot of rehab, and learning how to adjust to everyday life with these new deficits. And that's where PM&R kind of steps in, because they're best as far as dealing with the long-term rehab process, as far as functional recovery down the road. There are some other things that are overlap, such as like pain medicine. You can do pain fellowships through both neurology and through PM&R. So that's like there's a little bit of overlap in that area. But I would say like one of the main key differences is that neurology is more so diagnosis and treatment, and PM&R helps with the treatment, but more so on a long-term spectrum, and more so helping you adjust to everyday life with your new deficits and symptoms that are permanent, and hopefully also regaining some function and things of that nature.
So I actually answered this on Facebook, but the analogy I used was you can think of neurology. We figure out we put the jigsaw puzzle together. We figure it out and put it together, and PM&R is the frame that holds it up after it's done. So basically, they're the support for the patient as they adapt to that to whatever disability they've acquired, like Dr. Moore said.
Yeah, I'll also say it's also kind of more, PM&R is more procedure based than neurology in general. Although, if you get into the neurology subspecialties, you can end up doing quite a few, be really knee deep in procedures, especially if you go into pain.
So I'm actually working on the brain injury training milestones. I'm on the committee that's doing that. And so you come into brain injury medicine from neurology and from PM&R. And they actually talked about what Dr. Dada said in that, the PM&R residents may have greater experience with procedures entering into that fellowship, but the neurologists will have a different set of skills that are equally valuable for the brain injured patient. And that after 6 months or so, they've really melded together as a group of trainees on par with each other, because you're able to pick up those skills. They can pick up the localization skills that we have as neurologists, and we can pick up the procedural skills. And if you're like Dr. Dada, she's got all of that together. She can do the procedures, and she does the diagnosis as a neurologist.
Thank you for all the respondents. My next question is, so we know medicine is filled with various challenges, but there's also research as it pertains to medicine. And we have two terrific researchers here on our panel. And kudos to you. You spent a lot of time in medical school and also in residency, and as well as doing research. So I just really respect and admire that. But as it pertains to research, can you tell our audience how has engaging in research transformed your ability to be a clinician, and what is the importance of being a researcher and being in that space as a clinician? I'll direct this to Dr. Rowe or Dr. Dada.
Sure. I guess I would start by saying, number one, having a PhD is not necessary to be a good researcher, or for anyone to engage in research. I've found, so far for me, short career, that, doing a PhD, and especially having done it dedicated, kind of having, a separate before medical school, really increased my ability to question in a very different way. It increased my ability to kind of to think critically for myself. I tended to accept whatever I heard someone say who was in a position above me or whatever I read. I was like, okay, I guess that's kind of what it is. But when you spend time, defending your own dissertation, there's a process that happens by reading 1,000 papers in your field and understanding the depth that can be understood for a given topic. And sometimes it's obviously very hyper focused on one topic, doing a PhD. But, what I found translating when I was in medical school was I felt very different from my peers. I felt very different in terms of the way I asked questions, the way that I read papers, the way I analyzed papers, and the way I was able to catch things that a lot of people wouldn't catch. Look at data and just be like, that just don't make no sense. And, you can find things that are in, different name journals or whatever they may be. And, it's up to you as an individual, because, as a physician, you're relying upon a ton of, evidence-based research, but really it's to help you make your own decision about your patient. And so you can just read a paper and just say, okay, they said 20 milligrams, bet I'm going to do that. Or you can say, why that, what were their methods? And then you realize what may appear like crap versus what appears like something that's actually useful, as well as combining the data that you read from thousands of papers, but also trying to find a way to balance that with your specific patient, because your patient is a little different than maybe what's represented in the trial, And so I think really for me, it's the training and the mindset that taught me to be very critical. And now when I read things, I can better decide. And so far, as a PGY3, I've been able to read papers and think about how I want to design a treatment plan for my patient that maybe is a little different than what I've heard some attendings. And when I discuss it with them, they say, sure, I realized so far there's so many parts of medicine that really, once you get to the heights of it, it's more art than medicine, and they're not always clear answers. And so a lot of times my attending is like, it's up to you. And I'm like, based upon what? And I think, based upon what I read and how I'm able to analyze it. And so I think for me to feel comfortable making my own decisions, I need to be able to, evaluate comfortably whatever I read and then kind of make a decision based upon that. So that's just my spiel on actual research itself.
Yeah, I think for me, research or doing a PhD really taught me more than anything else that when your back is against the wall, when no one has the answers, and you have this problem that you're trying to figure out, the problem that you decided you wanted to figure out, right? Nobody told you to do this project. You said this project was great. You want to figure it out. You think you have what it takes to do it. And when your back is against the wall and nothing is working, which is 90% of a PhD program, you figure it out, and you figure it out and you learn when you're figuring it out how to think critically and independently, and it's probably the most valuable skill that you can have as a clinician, as well as a scientist if you're going that route. It kind of distinguishes you from being an observer and just someone who digests information. You're doing more than that. You're taking in the information, you are setting it in your own framework, and then actually doing something with it and figuring out the next steps. And so I think that's a really important quality, and it's something that is truly valuable. It's something that is not easy. It's extremely difficult. So it's not something to go into lightly. It's not something that you decide to do because you think it'll make your CV look good.
Yeah.
It's because you're gonna be in for a rude awakening, and it just kind of echoes what the other doctors on the panel said. That you should really decide to do what you're passionate about. And of course that can change, and that can change with experience. And I think one of the things that's difficult about medicine is that you don't really, you always have a bird's eye view of it until you're knee deep in it, and that's with whatever specialty you choose. I mean, you can do a sub-I and you can get in there. Yes, you have some experience, but it's nothing like being a resident, and it's nothing like being an attending, so I say go after your passion, allow it to change, be flexible, and yeah, I think that's it.
Thank you, Dr. Rowe and Dr. Dada. So student Dr. Ellen Sylvie asked, what are the most important aspects that programs are interested in when reviewing IMG applications? Dr. Flippin, you're the popular man right now. I'm gonna go to Dr. Flippin.
Well, I know that for our program, we've had a long history of having international medical graduates train in our program. I think the one thing that most programs and program directors look at is how adaptable will that particular candidate be in coming to the U.S. system, particularly if they're coming straight out of medical school and have not practiced or been in the clinical setting in the U.S. And I think that is from a practical perspective, that is the big issue. As far as procedurally, it's a matter of is the person a U.S. citizen or not, and will they need visa sponsorship? If you're an American citizen but you studied overseas, that's not an issue. But it's more so goes back to that practical issue of how will they be able to hit the ground running. And for an advanced program that is matching for people to start in the PGY 2 year, that program may not be as charged by that issue as a program that is categorical, where you're going to start as a PGY 1, and so whatever growing pains you may have adapting to the U.S. system will happen while you're in their training program, as opposed to an advanced program where your internship is separate and you will gain your footing during that year before you actually get to the neurology portion. Did that help?
Yes, it did. Thank you, Dr. Flippin. Student Dr. Eric Martinez Juarez, his question is, in regards to COVID-19, disproportionately affecting Black and Latinx, I know in LA, there's a huge Latinx population, West Side, okay, communities. How has this affected your everyday approach to these vulnerable populations in neurology and your commitment to serving them? I'll direct this question to Dr. Akinsanya.
So the reason why I'm a doctor is to serve these populations. So my commitment has been since day one, and there's really no, I always say like there's no point in me being a doctor if it isn't for the communities that I serve. And in residency specifically, Grady Hospital is the hospital where we see a lot of underserved populations who are very vulnerable because a lot of them may not have insurance or just lower socioeconomic status and lower healthcare literacy. So, you know, the reason why I'm a doctor is because of places like Grady. And that is my primary commitment, basically. In terms of the COVID pandemic, it was challenging, obviously, because, you know, none of us have been through a pandemic. And, you know, places like Grady, and honestly, many of the hospitals around the nation initially did not have the resources that we needed, and just, you know, trying to still provide excellent care to our patients in the setting of, you know, challenging times was very tough. But honestly, I can't even think of how my commitment changed at all, because like I said, it's so integral, it's so important, it's so foundational for me. So it's why I'm in this field. It's why I do what I do. What has been very influential is everything else that's been going on in this world, all the social justice issues that have gotten the spotlight. Obviously, they're not new, but you know, it's been a while since they've gotten the spotlight that they have. And so, you know, that has influenced me a lot as a person. But in terms of, you know, the way I treat my patients and, you know, the dynamic I have with them and the things that I do for them, that's always going to be a high standard for me. I am so grateful for the relationship I'm able to form, or I was able to form with the patients I had at Grady, and the, you know, opportunity to serve them, the opportunity for them to trust me, you know, was pivotal, and I never took it lightly. So I would say, I don't know if this answers the question, but I think a lot of minority students go into medicine, you know, with a desire and a passion to serve the communities they come from. And I can just say on the other side, it's very, very, very fulfilling. I'm so glad that I, you know, fulfilled the passion and the journey that I set out to do. I wouldn't have it any other way. I honestly cannot, you know, if I went back to the beginning, there's no way I would have known how influential, you know, my training residency being at Grady would have been on me. It literally changed my life and changed who I am in the best way possible. And I definitely have a renewed passion for it. But again, the standard will always be high because they deserve nothing less. And we as a people deserve nothing less than to get great care. And we need more people who look like us. So I really, really hope that some people who are on here that were maybe considering neurology, you know, will more strongly consider it now. Please feel free to reach out if you have more questions about why neurology, but it's definitely needed. And there's been so many encounters I've had with patients in neurology that have been super meaningful. And I know I've made a difference on them as much as they've made a difference on me. Hopefully that kind of answers the question. I don't think it directly answered it.
I can hit the LA part of that. So part of our residents rotate at 3 different institutions: the West Los Angeles VA and Olive View UCLA Medical Center, which is part of the Department of Health Services for the County of Los Angeles. So that's where we encounter most of our patients of color and have a large Latinx population. Since COVID hit, I think that we've leaned forward more in advocating for greater involvement in treating communities of color, particularly with the University Hospital in Westwood, which, if you're familiar with Los Angeles, the west side of Los Angeles is high socioeconomic status, largely Caucasian. And so we see the Black and Latinx faculty of the medical school. I've actually missed the meeting to be on this session with you about how the medical center, the university hospital, is going to change the way it acquires patients so that we are able to service communities of color through the university system and not just through the county safety net system. So that's how, what the pandemic and Black Lives Matter has done is that this is a window of time for activism where we can make some substantial changes of how we operate here at UCLA. And it's going to happen. There's a lot of energy and it's going to be sustained. There's a sense of community amongst us that is refreshing. And I will say that the giant is now awake, and so things will change. But we service and our residents find that rotating through the county hospital is one of the best educational experiences that they have in our program, and the most meaningful because we really see patients who need us, and we take that to heart, and we put everything we have into making certain that there's no difference in the care that we render to the patients in the safety net hospital from what we do at the university hospital. So many times we will refer patients from the county system to UCLA, and we'll find a way for them to get the resources so that they can get the care that they deserve.
Thank you, Dr. Flippin and Dr. Akinsanya. That's a perfect segue into our last question. Unfortunately, we have to go shortly, but this has been a terrific panel, and it segues perfectly into, if you were looking back prior to you starting your career in neurology, going to residency, what is one piece of advice that you would give that younger version of yourself moving forward and defeating the challenges ahead? Anybody can go first.
I've got the longest road probably to look back over. So I would say relax. I would tell my younger self to relax, that if you put in the work, you'll get your reward. And that would be the thing that I would tell young Charles, because you can play a lot of mind games, and we all have the challenges of imposter syndrome and all the other things that we have to carry around as people of color when we go into areas where we are in the distinct minority. I think that really understanding that you've got a great opportunity now to do things that many of us were not able to do in the past. I can say that as a specialty, neurology is probably more forward thinking with issues of equity than a lot of other specialties are. And by specialties, I mean those that are non-primary care specialties. I just did a Zoom meeting earlier today with our leadership training programs in the American Academy of Neurology on unconscious and conscious bias. We've been doing those type of sessions. We've had a diversity leadership program going on 8 years now. The specialty is looking for you and wants you, and there's a place for you in the specialty. So I can't think of a better community for a young physician to come into than that of neurology. And, you know, the stereotype of the bald white guy with the goatee and glasses, that's not neurology. Neurology is much more vibrant and diverse now than it's ever been. And we're looking for more.
I think I would say, you know, advice I would give to myself, I think I'm a little bit more of a serious person. So I would tell myself to just kind of stay in the moment. You know, this whole process of figuring out what it takes to get into residency and medical school, and figuring out your career versus, you know, what you think others want of you in order to get what you want. It's rough. You guys know, you guys are going through it. And part of understanding it and part of kind of treating that inner anxiety is, you know, kind of being on forums like this and listening to others who have gone through it before you. So you're already, you know, one step ahead. But, you know, just try to stay in the moment and have fun in the journey. Really, you know, immerse yourself in that experience. If it's a research experience, if it's a leadership experience, give your all to it. And definitely, you know, make sure that you continue to immerse yourself in organizations like SNMA, the national organization, the local chapters, as well as other societies for the specialty that you're interested in. If it is neurology, look for those local societies and try to get in on their, you know, now they're probably having much more virtual meetings as opposed to their conferences. You know, back then I was kind of using those conferences as ways to follow people and find people, finding the people that are doing what I think I want to do, and following them and talking to them and continuing to interact with those people and like people like that.
I can go next to end off. I guess before the advice, I would just give my plug of, you know, those interested in neurology. I would strongly consider you check out Emory Neurology. In my class alone, you know, there are 10 of us, and there are 4 out of 10 are Black residents in my class, and we've been maintaining a pretty good trend of trying to recruit. And so definitely check out Emory Neurology. In terms of advice, you know, in my short career, I would say don't be fooled by things that look like success. You know, I've been turning my camera on and off because I have 2 little girls running around like maniacs in the background. You know, I think I've struggled a little bit with the balance of, you know, trying to pursue success and trying to pursue, like I said, titles and things that kind of sound like it would be sounding nice, you know, things, you know, I'm in love with titles and things that sound nice. But I would say just consider your values that you have as a person in the pursuit of medicine. It's a mega dedication that we've all undertaken, but it is not. I don't think it should be the totality of my existence. As much as I love neurology, and as much as I love being a physician, and as much as time, you know, years that we've dedicated towards it, you know, there are other facets and aspects to life that, you know, I have to recognize that I value, you know, just as much, and sometimes in other cases even more, you know, like my family. And so sometimes I think that we can find ourselves losing a bit of those things in the pursuit of these things, in the pursuit of medicine. And you're in an environment where, you know, there are a lot of people who can do your job, a lot of people who will be there in case you can't be, a lot of folks who, you know, may or may not miss you when you're gone, you know, and those are just different aspects that I've experienced even already, you know, in my short journey. And so I would just say, consider your values, as you pursue medicine. In that way, I think you can feel good about what you're doing while you're actually there. Feeling good about spending the hours you're going to spend as a resident, and feeling good about the hours you're going to spend as an attending even after that, and in the lab, whatever you're doing, because that you've balanced, the rest of your life pretty well, and make sure that you've paid close attention to it. I think it would be the worst thing to pursue all these things and finally get there and then realize that you've been kind of shy on the other aspects of your life which are important, your mental health, your family, things that kind of give you that passion and give you the inspiration to spend those 24-hour shifts in the hospital, and so you're more than just that alone. While it is very important, and I love to treat my Black patients and minority health and all the different things and mentor youth, there's a lot that we are as people and as a person, made of. And so just kind of consider that along the way. And I think that's pretty much it for me. I'm happy to answer questions afterwards we sent our email. So just hit me up.
I'll go next. So I'll say the advice that I would give to my younger self starting out medical school would be to be open to all the options possible, all specialties possible. I think the key, as far as determining specialty, isn't as far as what looks cool, what sounds great, but sort of figuring out what is your career goals. What do you think that you want to achieve, and finding the specialty that lines up with those. So like just looking back at my career path, like if I would have been open early in my career to a career in neurology, I could have potentially avoided doing a year in surgery, or going through and doing different aware rotations in neurosurgery and ultimately deciding, I don't think this is the field for me. I definitely appreciate those experiences I had, and even though I did do an extra year of residency in general surgery, which those experiences will still carry me forward and will still be valuable in the future. But I could have potentially got myself one step closer towards my career goal in the end. But definitely, even if you've been since day one said, oh, I want to be a dermatologist or I want to be a plastic surgeon, but kind of looking at all the different fields that are fairly similar, because you'll realize in medicine there are a lot of overlap between different specialties. So figuring out what you specifically want to treat and what, if you do have any research options, what field of medicine you ultimately want to make changes and affect in a positive way. And also anyone interested in Baylor College of Medicine for neurology, feel free to reach out to me. I'll have answer any questions that you guys may have. It's a definitely great program with a diverse patient population, where we rotated 4 to 5 different hospitals. You get to see all type of not only diverse conditions, but you'll also see diverse patient populations as far as our county hospital where we serve underserved. We have a private hospital, also work at the VA where you'll see veteran population as well.
I'm going to follow Isaiah's lead and shout out Emory Neurology. It's an amazing program. Like Isaiah said, it's very diverse, which I loved, especially, again, with everything that's been going on in terms of social justice. I don't know what it would have been like to, be at another program where, I may have been the only, Black female there. Being at Emory was amazing because we really supported each other. And just my entire journey there, it was amazing to see upper levels who were, smart, confident Black women who I could aspire to be like. And I just really appreciate that part of my program. And my program, or my former now, program director is in the comments. So please email her because diversity is very important to Emory. So again, if you're interested in neurology, that is a great program to train at. But to answer the question in terms of what I would tell my younger self, it would be to be confident in myself and also to value what I bring to the table. you know, and that's not just what I bring to the table as, you know, a neurologist, but just me, who I am, and the things that I'm passionate about, and the things that are important to me. You know, like I've said, diversity is very important to me, equity in healthcare and in medicine specifically. Mentorship is important to me. And also, you know, things outside of medicine are important to me. Brunch is important to me. I miss it a lot right now, but like, you know, I'm a whole person. And, you know, it's important to value that. And, you know, again, like Isaiah said, it's important to remember who you are as a person, and not just think that you have to present yourself as this ultra, you know, smart, you know, neurology applicant who only cares about medicine and producing papers, and there's no other aspects of your life. There's other, you know, you're a whole person, and everything that you bring to the table is important. And, you know, to be at a program that values that is very important. If you feel like there are things that are important to you that a program doesn't value, then you should, you know, consider whether that's the best fit for you or not. And again, just to be confident in who I am and what I know, and, you know, not to second guess myself. I mean, this is a lifelong journey. I don't know when I'm going to fully arrive at that realization, but it's something it's an important reminder to just affirm myself, and to be around people who affirm me, and to look for avenues to feel affirmed. So yeah.
Thank you all. Audience, before we go, make sure you check out the questions that were answered in our Facebook comment section, and make sure you share this with all your friends and family that are interested in neurology. Neurology is the best field there is. There is no doubt about it. And you have terrific support and mentors here who have laid down their email contacts and information. And also, I want to say thank you to SNMA. Make sure you follow SNMA Official on Instagram and Facebook. This will be live stream. This has been live streamed, but the stream will be produced and established on the SNMA Facebook website so that you can peruse through it afterward. And make sure you check out the See Us campaign, which is a collaboration that we've done with all the medical students and physicians, showing support for SNMA and solidarity in the fight against social injustice, racial inequality, and the emphasis of empowerment for each and every one of us in our communities. So I want to thank you all for tuning in today. And we look forward to seeing all of you in the future. I look forward to seeing you guys. So thank you.
All right.
Thank you.